Good day, dear colleagues and future cardiologists. I'm Dr. Angela Hafizi Ruff, and today we are shifting our focus from simple metrics to integrated right heart hemodynamics, the cornerstone of assessing cardiopulmonary disease. We clearly visualize the right atrium ara, the primary reservoir of systemic venous return, leading directly into the right ventricle RV via the tricuspid valve TV. This is the foundation of our systemic circulation and a critical determinant of patient prognosis. Preload assessment, the IVC and RAP. First, let's talk about preload, the filling pressure of the right heart. This is assessed by the right atrial pressure rap. The most practical, non-invasive proxy for RAP is the evaluation of the inferior vena cava IVC. We must accurately measure the IVC diameter and its degree of inspiratory collapsibility. A normal IVC is typically small and collapses significantly greater than 50%, with inspiration suggesting a low RAP, for example, 3. A dilated, non-collapsing IVC signals elevated RAP, for example, 15 mmHg, indicating high volume status, or, critically, failure of the RV to eject forward, leading to systemic venous congestion. Why it's important to assess the IVC with echo. There are several very important reasons to assess the IVC with echocardiography. A couple of the more important are to determine right atrial pressure or central venous pressure, determining the pulmonary artery pressure, as well as assessing fluid levels in the patient. By obtaining these few measurements, physicians are able to treat patients on the spot. What does IVC collapse mean? By doing this sniff test, we can look at the inferior vena cava and see if it collapses or not. If it doesn't collapse or decrease in diameter of at least 50%, then we know the right atrial pressure is even higher. By asking the patient to sniff, it generates a sudden decrease in intrathoracic pressure, which would normally cause the IVC to collapse at least 50%. Afterload assessment, RVS-P. Next, we move to afterload, measured by the right ventricular systolic pressure RVS-P. RVS-P is calculated by adding the tricuspid regurgitation TR gradient 4 VTR2 to our estimated RAP. This provides the crucial non-invasive estimate of the systolic pulmonary artery pressure SPAP. An elevated RVS-P